Did you know there are approximately 100,000 people a year that die from adverse reactions to prescription drugs? While that is a shocking statistic, today's advancements in DNA and genetic testing technologies are making a dramatic impact in reducing those numbers. Researchers estimate that commonly prescribed medications may not work in up to 60% of the time. Healthcare providers often prescribe medications on a trial and error basis. What works for one patient may not work for another based on their genetic makeup and their rate of metabolism. A pharmacogenomic PGX test can assist healthcare professionals to determine the relationship of a patient's unique genetic makeup and their response to certain medications before prescribing, thus reducing adverse reactions to a drug. While a PGX test can make personalized medication a reality, a CGX cancer screening test can help determine a person's risk for developing hereditary cancer. Knowing this allows the patient to make diet and lifestyle changes before it's too late and provides important answers to unexplained illnesses that might have a genetic cause. This test includes, but not limited to, lung, breast, ovarian, stomach, kidney, prostate, oral, and more cancers. Administering these two screening tests is as simple as providing a single check swab and uploading patient data into our HIPAA-compliant EHR system, from which a licensed board-certified physician provides a complete review of the lab results by way of a telehealth consultation, discusses the lab results, and advises on care as needed. If a person has a personal history of cancer, or if they have one or more relatives with a history of cancer, they may qualify for our cancer screening test at no cost, depending on their insurance and/or if they have Medicare or Medicaid. To learn more about these tests and what they could mean to your health, contact the consultant that introduced these CGX and PGX genetic tests to you.